welcome to this week's product review with John and Lou. I'm John Flucke, and playing vanity to my purple prince is my good pal, Lou Graham. That was a good one, wasn't it, Lou?
This is going where I don't want it to go. Keep moving.
All right, Lou. So what we want to talk about this week is a base material that is really changing things, much more than just a base material, a liner material, as you will. Go. Let's see what you got for me.
So the material that we would really call a liner,
Okay.
yeah, the material is called TheraCal. We did a catapult review of this also last year.
Yes, we did.
Overwhelming praises.
Yes.
And I think the overwhelming praises on TheraCal was based on its chemistry.
Right.
And I'll be brief.
Good.
Okay. The chemistry is a resin-modified calcium silicate. So when you have a resin-modified calcium, I'll call it a silicate, it's really not like DiCal, but it is a calcium hydroxyl releasing formulation from a resin.
Gotcha. So in other words, you're getting kind of the best of both worlds. You're getting a resin, but you're also getting a resin that releases calcium hydroxide.
Right.
Okay.
And the system is literally, it's called HEMA-free. That'll be the last thing I talk about chemistry, but HEMA, I promise.
All right,
but HEMA is a really small polymer, and it can aggravate the dentin itself, the tubules, and all the fluid within it. So the fact that it's HEMA-free makes it, to me, much more biocompatible.
Okay.
Very important. Okay. So where does this fit in, this TheraCal fit in? To me, it fits in as a universal, deep liner underneath all my composites. It could be underneath someone's alloys, but it's a universal liner replacing the liners out there because, and the most important thing is, it's another bioactive material.
So when you say bioactive, give me an idea of exactly what does it do from a bioactive standpoint.
So this is a hydrophilic material, which we're going to get into in 2 seconds. But what it means is that as a bioactive material, the calcium, as it's released, creates an amorphic hydroxy, or really a more amorphic apatite crystal. So
You
it's
said
kind
no
of,
more chemistry.
Okay, but it's an amorphic crystal. So imagine creating new tooth.
Okay.
It's really amorphous in the first 24 hours, and over 7 days it turns to be more crystalline. So the literature presented at the IADR 2 years ago shows that it creates new tooth structure. That's bioactive.
So what's cool about this then is, you know, in the old days you would lay materials down as a base or a liner, and you would get sclerotic dentin, and basically, you know, the pulp is kind of painting itself into a corner, as it were, or pulling away from the insult and putting up reparative dentin. And that was more like repairing from the outside in. TheraCal repairs from the inside out.
In a sense, you're absolutely right. Where glass ionomers, and glass ionomers are not indicated near the pulp because of the fluoride release, this material has no fluoride release. So where glass ionomers create a great seal, and I still use them, that would be for my base in a deep restoration. Below that glass ionomer would be a TheraCal. But let's say you're not that deep in a restoration and you want to put this over caries affected dentin. This is what I put over caries affected dentin, and this changes my philosophy, and it's a philosophy where I don't want to over drill. And the literature, and it's controversial, but to me it's not controversial, is that don't over drill. Just take out the infected dentin, cover it up, and now with TheraCal, create some new apatite and put your composite over it. So you put the TheraCal down, you're going to etch and bond and put your composite over that.
Now you talked about moisture just a little bit ago. Give me the whole thing on the moisture and how that enters into this equation.
So the technique tip would be on this material, after you're done removing the decay, and we've gone through the decay process and removed it as carefully as possible. Once we do that, I'll clean the tooth, whether with some actually bleach, sodium hypochlorite, 2% chlorhexidine, or ozone. I'll clean the tooth. And now, before I put the TheraCal down, I'll take a little micro brush, dip it in a little water, patient napkin, then just wipe off the excess. And I just moisten the tooth a little because it's hydrophilic. And so what will happen is you take and it comes in a syringe. You just put a new
the
tip
syringe
on.
delivery is
it's so
amazing.
Easy.
Yeah, it's great.
And it's inexpensive. It's $25 a syringe. So all you're going to do is inject the material very slowly through this narrow syringe that acts kind of as an explorer to guide it, and it can be no thicker than 1 millimeter, and you just light cure it. So a little moist dentin, and then all you're going to do is guide it with the syringe.
Magnification makes a big difference, yeah.
And then all of a sudden, you're just covering the deep dentin, light cure for 20 seconds or appropriately, and now you're ready to etch bond or put your glass ionomer over that, but etch bond and put your composite. So as a liner, unbelievable. Last tip. Their literature, Bisco's literature, it's a Bisco product, is saying you can use this for direct pulp caps.
Okay.
Let me just say I'm cautious. Where I've used...
As we should be with those type situations.
I'm not a big resin believer near the pulp. But let me just say, I'm throwing it out there, this is one of their uses for it.
Okay.
I'm still an MTA or a pure calcium hydroxide user. Different part of another story that we can always talk about. But that's kind of how I look at it. An invaluable liner, and I can say at the Catapult Group, an invaluable liner for all of us at the group.
Yeah, absolutely. I mean, when we did the testing and the clinical evaluation of it, I was blown away with how easy it is, the results, the lack of sensitivity when you're done, and just how easy it is to use.
So how does this affect all of you? Don't over drill. Don't find that pulp. Stop drilling when appropriate. You can leave that caries affected dentin and now use products such as TheraCal, very simple to place, and it's really meant as a universal liner. And with that, thanks again so much for your time. More tips, tricks, and truth in product review in the next episode. Thanks for joining us.